to flu last winter, and it seems most of them were young or middle-aged. New figures from the Health Protection Agency show more people died last year after contracting the swine flu strain than in the previous year's pandemic. Across Britain, a total of 602 people died during the 2010-2011 winter flu season, and among them, more than 70% were young or middle-aged. 50 children under the age of 15 also died. Last year's outbreak came amid reports that some GPs were struggling to get hold of enough vaccine. That prompted the government to raid the stockpiles as hospitals were forced to cancel operations in order to cope with the care for critically ill flu patients. Well, the report reveals one cause for concern. Only 50% of people in the at-risk groups took up the chance to be vaccinated, and that is a much lower take-up than previous years. We're joined now by Professor John Watson, head of the Respiratory Diseases Department at the Health Protection Agency. And my understanding is that most of these deaths were amongst at-risk people, the people who were perhaps ill from other issues or weakened by other issues. But what concerns you most about these figures?
Well, I think the important thing to remember is, of course, that we see flu every year, and of course, sadly, due to flu, people die. What's been a little different about the flu we've seen in the last couple of years is that the impact has been rather greater in younger and middle-aged adults and rather less in older people. And as a result, there have been a lot of people seriously ill in hospital and a lot of people dying. And among
And that's
those,
more than the usual quotient you see, for example, 15 children. Is that higher than you would get from a normal flu epidemic?
well, there isn't a normal flu epidemic. The way in which flu strikes each year varies every year in terms of the age group, but more often than not, the toll is mostly among elderly people, and sadly. But there is illness among the younger people, and their vaccine is a very
Well, before you talk about
way.
the vaccine, why? Why younger people? Why are they affected more than older people?
Well, flu affects a very large number of people. Among them are some who have underlying conditions that make them susceptible to the severe complications, and they are at very great risk, and therefore they are among the group that we really recommend the vaccine to. But in addition, even among healthy people, when a very large number get an illness like this, sadly a very small proportion can become severely ill.
Well, you mentioned vaccines, and I mean, we have an effective vaccine, there's no question about that. It is surprising that only 50% of those who should have been eligible to take it up actually did get vaccinated. What explains that?
Well, there's no doubt that there is room for improvement there, but let's not forget, firstly, that among those over the age of 65, uptake is approaching 75%. I think it was 73%.
But that doesn't mean they don't get it anyway. The swine flu.
Indeed, the swine flu, but they get all the other kinds of flu which are also around and may well be what comes next year. Under 65, the uptake has been increasing, and so although the 50% was a little lower than it was in the pandemic period, it's higher than it has been in the previous years. But it is coming up, but there's room.
But the government didn't actually get out and advertise the vaccine in the way that had previously been done.
Well, the important thing is that people do get vaccinated and those numbers go up. And the most effective way to persuade, I think, any younger individual or young adult to be vaccinated is the advice that they get from their healthcare providers, their doctors, nurses and others that they come across. That's the most influential thing. And it can a bit emphasise one further point, which is among that group, of course, are pregnant women, and we're strongly recommending that pregnant women during the flu period should be vaccinated.
Professor Watson, thank you very much indeed for coming in.